Thank you for joining us today for this press conference by the Alabama House Democratic Caucus. We will now turn things over to our Minority Leader, Anthony Daniels.
Thank you, Katie, for introducing me, and thank the press, the media, for being a part of this very important press conference. I'd also like to thank our members that are also on Zoom, on Zoom or on a phone call, and those individuals out there that are tuning in via Facebook Live, as well as those that have been invited directly to the Zoom meeting. And so just want to thank you for that. I want to thank the members for the hard work their hard work and dedication back in their districts. Understand that I know that they say that this is a job that is part-time, but understanding that most of the work is done back in their districts. And so thank you for the hard work that you're putting in your districts. I know that we ask a lot, and you've certainly been serving the people of Alabama very well. We're all eager to get back to Montgomery and get Alabamians back to work, but we have to do it the correct way. We have to be smart about it. The state budget is pivotal to combating and ultimately beating the coronavirus. It's also going to play a crucial role in Alabama's recovery. But we can't mount a strong battle against this virus when there are more questions than answers. Unfortunately, right now, there are more questions than answers. We have a responsibility to pass a budget that meets the needs of our people, communities, and economy. We have a duty to pass a budget that puts all Alabamians on the path for a successful recovery, not one hastily thrown together in the heat of the moment. This isn't about politics. It's about doing the right thing. Now more than ever, we need to follow the best practices from both a health standpoint and a budgeting standpoint. We want a budget that works and a budget process that's considerate, deliberate, and open. Moving forward, when there are more questions than answers, isn't just unnecessary and illogical, it's fiscally irresponsible, and it's just bad public policy. Well, there are so many unanswered questions. Some of the most important ones are, how can we begin to craft a budget when we're still yet to fully grasp the impact of this pandemic on our citizens, small business owners, major employers, schools, healthcare system, cities, state agencies, and more? What's the impact on businesses and revenue? How many businesses that delayed their sales tax payments last year will be able to pay them this year? How can we craft a budget that meets the needs of some more than 275,000 unemployment claims that we received since March 16th? Residents and their families who face long-term unemployment during the fallout of this crisis. How do we know what our school needs, our students, teachers, and families, or with the possibility of extended closures amid a potential second wave? How can we make accurate projections to manage an economic crisis when we still don't know the scope of the current healthcare emergency? How can we responsibly prepare a budget without knowing what we have to spend and where we need to spend it? The state income tax receipts won't be in until July 15th. How can we use last year's number to make accurate projections during this unprecedented crisis into the future? How can we estimate how long the pandemic will last or how widespread it is when we don't even have stable testing and contact tracing? Our communities are facing more questions than answers. Our teachers and school children are facing more questions than answers. How do we upgrade our technology infrastructure for unserved and underserved Alabamians at a time when digital communications and broadband are more important now than ever before? For our students, teachers, and schools, there are just more questions than there are answers. How do we provide healthcare and the healthcare needs for those more than 300,000 uninsured Alabamians who now face potential serious illness due to this pandemic? How do we support and increase needs for our nursing homes and senior facilities, which have been hit the hardest during this pandemic? How do we get them the resources they desperately need as a vital part of our healthcare infrastructure? How can we help our healthcare system and hospitals make up for lost revenue and staff due to the halt in elective procedures? How can we provide for the needs of our rural healthcare system when 90% of rural hospitals across America are operating in the red and a shortage of doctors, nurses, and skilled staff for them to grow? Our healthcare system has more questions than they do answers. Across Alabama, there are more questions than answers. In fact, we don't even know all of the questions we need to be asking. Every day we're learning more about the threat of this virus that this virus poses and its potential for widespread and lasting impacts than we knew the day before. A month ago, we didn't know the virus could spread by those who were asymptomatic. Weeks ago, we didn't know the importance of wearing masks out in public. Until recently, we didn't know that the threat it posed to seeing seemingly healthy individuals and those with underlying health conditions. And many of our communities across the state have lost loved ones because we didn't know. The truth is that we're learning just how much we still don't know. We're all ready to get back to work. We want people to get back to work and Alabama businesses to eventually open. But we want to reopen our state by beating back this virus, but working smarter, not harder. Haste makes waste. This year's budget isn't about checking a box. It's about assembling a strategic and comprehensive plan to combat the coronavirus and launch our recovery. Let's make the most of our limited resources in this unprecedented situation. Let's focus on fighting the virus and jumpstarting our economy, instead of rubber stamping a budget that's put together with limited information and input. At the end of the day, this year's budget may be the most important budget ever. Unfortunately, this virus doesn't operate on our schedule. We're in a new environment and it shouldn't be business as usual in Montgomery. We're eager to get the budget done, but smart enough to know that we can't afford to get it wrong. The more we know, the better position we'll be when it's time to make these important decisions. There are too many unanswered questions. There's too much at stake. Too many lives are on the line. We can do this together and show that Alabama is ready for any challenge. Let's get the answers now so that we don't have to go back to work 2 or 3 more times to get it right. Don't rush the budget. We have a job to do. Let's get it done well. We want to get the budget done right. We want a budget done right, the right way, but not right away. Thank you.
Thank you, Minority Leader Daniels. We will now open it up to the press if there are any questions for the Minority Leader. And you can submit them in the chat box, or we have the Q&A box for questions as well. Our first question. Hello, this is Caroline Beck from Alabama Daily News. When would you like to see the legislature pass the budget, if not in the next few weeks?
Well, I think that, based upon our March numbers, we can't anticipate consumer behavior as a result of this pandemic. And so for me, I think ideally in July will be the best timeline, and looking at our tax receipts on July 15th to start making decisions, especially on our education trust fund budget, but also evaluating our the sales tax over the next couple of months. The governor opened retail at 50% occupancy on yesterday. She had a press conference, but those businesses will reopen, and we have to evaluate those tax receipts in order to make an informed decision. Right now, we're budgeting in the blind, and this is just totally fiscally irresponsible.
We have another question now.
Mm-hmm.
This question is from Mike Kaysen. Does most of the Democratic caucus agree with you, and do you expect Democratic members to attend next week?
Democratic House caucus members this are on the same page. Most of our members are feeling the same way. They feel that there's some that are more deeply concerned about the health. How we're demonstrating to the public that we are taking this particular pandemic seriously if we're doing opposite of what we're asking them to do. And so there are some members that believe that actually have underlying health conditions such as myself. And it doesn't really matter the age of the individual. I think that for the most part, legislators across the board have the same feeling. But for the most part, I think that it's just totally irresponsible for us to pass a budget in the blind and not be able to understand what our revenues are going to look like. I don't think it's fair to the members to make that particular decision or cast a vote on something. And in fact, we've not even seen the budget. And so you're asking me to vote on something that I've yet to see.
The next question says, what happens if you pass a budget now and revenue isn't close to the projected revenues in that budget? Will the legislator have to return or implement proration?
Well, that's a good question. It depends on how deep how deep the projections are. And that's why, to our point, that's why it's just not smart. It's not good public policy for us to be voting on a budget blindly. And yes, you may end up going back into one or two special sessions, and so which will cost the taxpayers even more money. And so yes, we will likely have to go into another session to make some changes to that.
Are there any additional questions at this time? Our next question, can you talk some about the amount of money that it costs the taxpayers each time we are in session?
Well, the budget office, and talking to someone from our budget office, for a week-long session or in a special session, it costs between $364,000 and $400,000.
Okay, the state received about $1.7 billion in federal funds under the CARES program. How should the state go about deciding how to use that money? Senator Marsh suggested using $800 million for broadband.
Well, I think that that's very broad, a broad statement of saying using it for broadband, but I think we have to prioritize it by looking at unserved and underserved. I think based upon where we are right now, a lot of our young people across the state of Alabama, especially in these rural communities and urban communities, don't have access to the internet. And so one of the things that we have to do is when we're receiving these funds, we have to prioritize it based upon need-based first. That should be the priority. Because if we're saying that every child deserves to have a high quality education in this state and in this country, then we need to make certain that we are helping them have a shot at getting a quality education. And so right now, you got kids right now that are in communities with no broadband access. And so, we've been talking about broadband for a number of years. And every year we're talking about broadband, and I certainly agree and support it. But we have to start talking about prioritizing those areas that are in need first.
Our next question on face. So our next one will, do you see the importance of having members and staff tested before returning to session?
Absolutely. I've not made, yes, absolutely. I think that personally, I think that members and staff should be tested and based upon, when those results are coming back. Just testing someone just to test them is not enough. We have to make certain that we are getting the test results. Right now, you still have individuals that are waiting 8 to 10 days to get their test results. And so if in fact there is a way for us to be able to get a 24-hour turnaround, I think that members should be tested, quarantined as well. And then I think that then we go into session. I think that is something that we have to look at down the road as well, right? I think that if we meet in July, that should still be the standard practice because we've been testing individuals that have symptoms. But we know that the research is also telling us, based upon experience, there are a lot of individuals that are carriers that don't know they're carriers. And so we just have to be very, very careful about that. And to the staff in the State House, having them go back to work under these conditions is also unfair.
All right, it looks like we've answered the questions from our press. So we'll give it back to you to close things out for us.
I just want to thank the members and reiterate that when we're talking about going to work, we're not at all against going to work, but we want to make certain that we're working smarter. Right now, this is just a reckless situation to go in and try to build a budget blindly. And also understand that members are working hard in their districts each and every day. Members are out there trying to make certain that PPEs are getting to their businesses and folks in the community. They're out there working with our food banks, making certain that they're getting the resources that they need to feed families and individuals that are hurting at this particular time. They're pressing to make certain that our young people have access to internet service and making certain that they have a shot at really being able to work to be taught at home by whether it's internet access, and they're working with local systems to make certain that they're providing that free internet access or Wi-Fi in neighborhoods that are close to them. So our members are working extremely hard. And I also have members that have had family members that have passed, multiple family members that have passed from COVID-19. And these are things that we can't ignore. I believe that we have to be very, as we look forward, if in fact we are able to wait to make a better decision, a more informed decision to address budgeting, I think that's what we need to do because right now we're putting folks and their families at risk. So thank you.
Thank everyone for joining us. This ends our press conference for today.